Ladies and gentlemen, welcome to the first guest at PrizeCast. I cannot tell you how excited we are to bring you the first interview of the history of PrizeCast, which we hope will be long and storied. But first, I want to tell you that we're going to be here every weekday at noon. And also, I want to tell you that tomorrow here at noon, Chef Melissa Brandon from Food Prize is going to be bringing you ramen hacks, like hacks you can do with your ramen. So it's going to be phenomenal. But for right now, we have an incredible guest that has done so much for the Film Prize and is doing a lot of other things she's going to be talking about very soon. Ladies and gentlemen, please give a warm virtual applause in your own socially distanced domiciles to Jaya McSharma.
Yay!
Yay!
Social distancing, yay!
Yay! Well, I want to start because, I actually saw you on a recent video podcast with the talented Melissa Munns, a podcast
Yes.
or a vlogcast called Pigeonholed, which we'll post the link to. And I've always known you as a Film Prize filmmaker. I've always known you as a Best Actress winner. I didn't know you are Dr. Jaya McSharma.
I am an MD, a real doctor. Like, I went to medical school and everything.
It's crazy, and I'm curious when you took the Hippocratic Oath and did all the things that you did, and I'm sure you've seen all the television shows that sort of laud doctors as sexy sex symbols. Did you ever sort of imagine that you'd be in a world where you'd be regarded as a hero?
No, doctors usually get blamed for a lot of things, has been my experience. Long wait times, et cetera, et cetera. But no, this is wild. I always wanted to be an Avenger. This is probably the closest I'll ever get. But people have been so kind about this. So no, I shy away from the term hero. It's very kind, but it feels weird to me, but I'm happy to do my job and happy for the appreciation. It's really sweet.
Well, again, you hear the word unprecedented, you hear the word strange, you hear the word crazy. These times are unmatched by any other in history for a long, long time. Can you describe what you're seeing out there?
Yeah, well, I started a couple days ago on a new shift, and every 24 hours, our coronavirus cases have doubled in terms of hospital admissions, which is crazy because only 30% of people who get this virus will require hospitalization. So I think I only saw one patient today all day that did not have coronavirus, which is insane.
And that's crazy because it even goes deeper than that. If I'm not mistaken, it's been in the news that your hospital was really the first place that had a confirmed coronavirus patient.
That's right. Yeah, I was fortunately off for a little bit, I think about a week and a half. The day I left, we had the very first confirmed case. It came in as I was leaving work. The CDC called, or the state health department called and said, yes, positive for corona. And we all went, until then it was just kind of floating in the air as this mythological virus that may or may not show up. And then all of a sudden it was like, nope, it's here. It's on the second floor. It's in our hospital. And just in the week and a half that I was not at work, it went from one patient in one room, in one hall, to an entire floor of patients that we have now.
So when you go to work, I'm imagining you going to work is quite different from the way you used to go to work in every regard. Can you just tell us a bit about what that's like when you walk in those doors?
Yeah, we can only go in and we can only exit through one entrance because everybody has to be monitored. So I go in that special entrance. As soon as I enter, there's two women with full masks and protective gear asking me, have I had any fever? Have I had any symptoms? Have I had any travel or health exposure? And then they take my temperature and give me a sticker for that day that says I'm cleared to be in the hospital. So that already is massively different. Then when I'm walking in the halls, everyone has their masks, goggles, and gloves on, even in the cafeteria. And then we just all kind of make eye contact because you're trying, number one, to see who it is because you can't recognize anybody anymore. And then secondly, you just kind of feel like, oh, hey, okay, it's you and me in this fight against this insane virus, this deadly virus. And there's a sense of unity in the hospital, but our day-to-day practices have completely been transformed.
So, I mean, do you feel the drama of the circumstance, or is it something where you're just, is it something where you're just kind of doing your job now?
I mean, I think it's a little of both. You certainly watch those movies like Contagion and Outbreak, which I've watched recently. I don't know, just to like torture myself some more. I don't know what that's about.
Yeah. Nice job on watching Contagion. Yeah, that's a good way. That's a good way to kind of bring down the night. That and a glass of Chardonnay.
Yeah.
We'll always get you there.
If you want to wind down and move away from the anxiety, watch Contagion. But it is very dramatically portrayed. And of course, we're not dealing with the same symptoms in terms of this virus, but in terms of the spread and the precautions that we have to take, they're the same. So sometimes when I'm on the second floor, which is our coronavirus floor, or what we call Area 19, which is a great name for a short film, I think.
Oh my God, it is. Absolutely.
Right? It takes me, I mean, the time is cutting down, but it takes me sometimes up to 20 minutes to gear up with everything that I have to wear. And it's so hot in all of that equipment. And I just look in the mirror and I can't believe that this is my daily life now, because it is straight out of a movie. And once I get into the patient rooms, the routine is pretty much the same. It's patient care as it always is, but I'm also having to yell because they can't hear me through the double masking and the shield, and they can't see my mouth. So communication has been a little bit more difficult because of that.
What do you have to say to those who are out there that still don't seem to be taking this virus seriously?
I wish I knew the magical combination of words that would like make something click in their brain that goes, oh, this is deadly and I should stay at home and not be the reason that hundreds, possibly thousands of people become infected and die. All the information is out there. I guess all I could say is, if someone's pointing a metaphorical gun or a literal gun at your loved one and they said, hey, in order to save their life, all you have to do is stay at home, sit on your butt and not move or leave the house, would you do it? Because that's where we're at. And if you're ignoring all of these precautions and quarantines and social distancing at this point, then in my view, you're guilty of criminally negligent homicide, because people are going to die because you're not willing to do this one thing, which is insane to me.
And you've really taken some pretty incredible strides to communicate that. Of course, like I said, we're going to put the link to the Pigeonhole video podcast that you do with Melissa. You also, I think was it last night, you did the piece on ventilators, which again, it's almost, people look at that as, well, if we have enough ventilators, everyone's going to be okay. But not even that's not correct, right?
No, I was talking with some local doctors and we were kind of running the statistics coming out nationally, coming out statewide, and matching them to what we're seeing. And they're correct. So 30% of people who get coronavirus will need to be in a hospital. 30% of those people who need to be in a hospital are going to end up on the ventilator. 50 to 80% of the people who end up on a ventilator, which means you can't breathe on your own, you're on life support at that time, will never go home. They won't survive. And so what I want to say to people is, we're doing everything we can, but at the point when you can't breathe on your own and you're on life support, we really don't have anything left at that point except for hope. And there's a good chance you're not going to walk back out of that hospital. And we're seeing it in younger people, healthy people. It's not just over 80-year-olds with multiple health conditions. And even if it were, it wouldn't matter to us. But I don't want anyone to have this false sense of security. These numbers are real, and I'm seeing them on a daily basis at my job. So I wouldn't roll the dice on that.
It is interesting. I mean, I'm almost feeling part of Jaya, your passion that I've certainly experienced with you and with your filmmaking in the delivery of this. You are, of course, as I've recently found out, you're a doctor,
yeah.
which is awesome. You're a new mom. You have a young son, and
yes, 5 months old.
Yeah, 5 months old. 5 months old. Beautiful little boy. You're going to have to throw us pictures and all this. Aww. I'm curious. You throw in the filmmaker part. How do you juggle these three things that are seemingly in divergent universes?
Yeah, I'm still learning. I mean, it was hard enough or difficult enough to juggle doctorhood and filmmaking writing and acting, but then you add a baby to the mix and everything goes out the window. But I would say, a lot of people, I think, during this quarantine are feeling a lot of pressure to write the great American novel, write the great American film, or not even the American film, the great worldwide, whatever piece of art that you want to make. And I would say to those people, don't put so much pressure on yourself right now, at least during a crisis, because this isn't a vacation. It is a pandemic. So I think day by day, you can do it all, but you can't do it all at once. So day by day, I have to choose what my focus is and really focus on that, because I don't know, can I say half-ass on this thing?
You can say all sorts of, we haven't figured out what you can say and what you can't say, so you can say whatever the hell you want at this point.
Okay, oh, nice.
That's
okay.
Right.
My mom might be watching, but
Yes.
I think she's okay with half-ass.
Good.
So rather than half-assing multiple things, you want to do one thing well. And so that's where you get your sense of accomplishment and completion. You tend to stretch yourself out if you try to spin a bunch of plates all at once. So I think prioritizing what's important in the moment for that day, for that week, is the only way to really move forward.
So, arcing out of this, we are going to go from the darkness to the light, right?
We are.
I'm curious, even taking what you just said, is this crisis sparking any ideas? Is there anything that's sort of mulling about as you're sort of heading in and out of these halls, coming home, sitting in the dark watching Contagion? Are there things that are really starting to kind of click that you think you might be able to utilize creatively?
Yeah, I think I was thinking, everyone's going to make a movie about the quarantine, so maybe I shouldn't do that. But I do think that I am able, because of my job, to have a unique perspective on this side of the virus because of what we're seeing every day. And so I don't have a fully formed idea, which is fine. I'm telling myself that's fine. But every day I'm coming home and jotting down notes about what I'm experiencing, what the patients are going through, what we're seeing, because I feel like I'm very blessed to see this side of things in such an unprecedented, I need a new word for unprecedented, but I get to see a very special side of this thing moving forward. So I can't imagine not doing something based out of this time in my life and this time in the country, because it's just so unique.
So, do you ever think that you might be not doing something on the medical side? Again, I can tell you that you've always seemed to do things in your filmmaking that connect to you, though I'd love to hear how the last film, Best in Show, connected to you. But have you ever thought about just going a totally different path and not doing anything having to do with medicine, a virus, or people being in ventilators?
100%. I think it's probably a terribly kept secret that I always say I'm a doctor, but I'd rather play one on TV, because that's where my heart is, in writing, acting, expressing, and making creative content. I don't want to take away from being a doctor, because, oh my God, I get to help people on a daily basis. But I think the things that are important about being a doctor, the times I really get to help someone, are when I get to connect with them and hear their story and let them know that they've been seen and heard. And I think you can do the same thing through filmmaking. So I'm totally okay helping people through art while getting to utilize what my passion is. Yeah, I'd love to be full-time filmmaking, and I'll work as needed at the hospital whenever they need me. It's fine.
I love it. How about you and George Clooney?
Yeah, right.
You guys, you and George Clooney.
Yeah,
absolutely.
Come on.
Yeah, it's yes, it worked for him.
Right.
He was on ER, and now look at him. He's a celebrity.
Exactly.
So you are also incredibly in touch with a pretty tight independent film community. Now, when you look at what the Film Prize has sort of brought, it's gone from sort of regional to something national. Can you kind of give us for lack of a better term, a temperature check on
how's everybody
that
doing?
Community? Yeah, how's everybody doing? How's everybody feeling out there?
Yeah, it's crazy to me to even hear you say that, because even a couple of years ago, I remember being at Film Prize and thinking I could never be part of that community. But once we started making our own content, when we entered with our first film, everyone has been so welcoming. So I just want to say that, put that out there for anyone considering making a short film. Don't question it, just do it. This community is amazing. But anyway, yes, I think everyone's holding their own for the most part. It's really difficult because we can't reach out and hang out and physically get any support by by socializing. But people are coming up with their own ways to cope. I know Christine Chen started a group where you could write one page of a story, the plot of a movie or a story, and then tag the next person. And they kind of a round robin writing group. So that's been really interesting. I haven't gotten to participate, but I love that idea. And then we'll make a lot of content with New Munns Productions, or Melissa and Josh Munns. And so we have been going crazy the first couple of weeks of the quarantine, and they're like, okay, we can still make stuff. We just have to do it virtually now. And so it's been really important to us to continue creating together, because it kind of helps us feel a little bit more normal. And I think people are really, really excited once the quarantine is lifted to get out there and start making some art.
You know, and we're actually hearing some pretty interesting things where people are actually saying that they're almost more excited about. Of course, we're all excited. We're like the shaking up of a champagne bottle. Hopefully
Exactly.
We can pop that cork and get out there.
Yes.
You know, so are you feeling that connected and that energized that when when we get the all clear that you're going to be out there doing some more?
I feel like we're just all being held back by a gate right now. Like everybody wants to jump and run and move forward and do what they want to do. So when we get to the other side of this, I see a real flourishing of activity and connection and community happening. We've just got to get to that part of it.
So, I mean, you know, when we do get to the other side, I mean, you have 3 distinct sort of parts of your brain that I don't even know how they talk to each other, right?
A lot of voices.
You know, mom, right? Doctor, filmmaker,
right.
Creator, actress. How, you know, again, do you expect to operate on the other side, and what are you looking most forward to connecting with as far as those different parts of your brain?
I think I'm looking forward to being able to meet with people and make things, record things, make videos, skits, movies again, because that's when I feel most alive. I also love taking care of my son. He's great too. But I think I'm just looking forward to, there's only so much you can do virtually. And I think by the time that we can all get together again, I'm looking most forward to actually making as many videos and movies and shooting content as possible. I cannot wait for that.
I love how doctor wasn't mentioned. I mean,
did I not? Yeah,
I mean, I don't know if that was a psychological slip, but yeah, it was. I mean, but I can see this. I mean, I can see that, like, I probably would imagine a lot of people in the medical profession probably thinking a little bit about taking a break or needing some other sort of diversion after going through something like this.
Oh, for sure. I mean, we can't, even our off time, just like anybody else, we can't even travel anywhere. We can't even really see our families. I mean, my son and my husband are living apart from me right now because I just didn't want to risk infecting them. So that part really sucks, you know? So yeah, I think everyone's kind of looking forward to reclaiming normal life, and also we'll have a newfound appreciation for all the things we don't get to do right now. Also, I'm like the stereotypical Indian that didn't want to go to medical school, but I just did it because my parents told me I had to. So, you know, one of those things.
Oh my God, you just put it out there. They're like,
I did.
But I guess that short's been done, right? I mean, like, you know, I mean, I'm sure that film has been done over and over again. It has. It is almost.
It's not even unique. It's like, I'm brown, I'm a doctor. That's just what happens.
You know, yes. I mean, and I'm Jewish and I'm a filmmaker. So what are you going to say? I mean, it's like, you know, it's, so let's say we get to that other side and we're in this place where we all, you know, intend to be, where the world is normal-ish again. What advice, having gone through what you've gone through, especially during this health crisis, what advice do you have to give those mothers, those creators, whether it be filmmakers, musicians, artists, or even doctors? What do you tell them? What advice do you give to them after all the experience, good and bad, that you've gotten from this?
Well, I think the most important thing to realize is that we have such a special opportunity to band together and really save lives right now. So I think the most important thing I want people to know is, number one, don't panic. You know, don't freak out. If you're doing everything you can, then just kind of let go of trying to control everything, because you'll never be able to do that. But the sooner we can get everyone to do the right thing, the sooner we can all start socializing again, the sooner this will be over. we're never going to get over this hump unless everybody works together. So I would say control what you can inside your household, but do your best to educate friends and family so that when we get past this, you can return to a normal life. And I would also say we are going to get past this. I promise. It's coming. And then after that happens, I think we all will have such a new appreciation for everything we haven't been able to do now. And all I can say is maybe take this time to reflect on what is most important to you so that you keep those priorities whenever life returns to normal, because that's how we're all going to maintain a sense of unity, grace, and fulfillment.
And the good news is, Jaya, by the way, beautifully put, but I just want to tell you that the hashtag ain't no party like a Jaya party is trending right now. So, I mean, we all want to be there with you. We all want to be there with you for that party. 100%, we want to be there for you and be with you, be there with you. Well, Jaya, that was phenomenal. And I cannot tell you how much we appreciate you and everything that you're doing out there. Any parting words? I mean, again, this is our first Prizecast with a guest. You better knock this out of the park. These last words are very, very important. Go.
They're very important. Okay, believe in yourself, take care of your family, get ready to make lots of art together, and you are the prize.
Absolutely, you are the prize. Thank you so much, Jaya McSharma. Remember, tomorrow, Melissa Brandon will be here on Prizecast. Thank you again, Jaya, for your time. Thank you for everything you're doing on the health side of things, and we look forward to seeing you very soon on the big screen at Prize Fest and everywhere where we can celebrate with you. So thanks again.
All right, great. Salut.